Hi, my name is Helena, and I'm going to present to you today the Hermia lung lobar quantitation software. This software allows you to quantify the amount of function in each of the lung lobes and therefore guide the surgical resection of one or more of those lobes and work out the amount of function the patient will have left after surgery. So here on the screen we can see the perfusion overlaid on the CT. We have a wizard workflow to guide you through the steps of the processing. So I'm just going to hit next on this one. So the first step is to check the alignment of the scans. We can see here, so on the way in, the software will check to see if the scans were acquired simultaneously. If it finds that they're not, it will do an automatic registration. So already we should have a decent alignment here, but if not, you can make a change. So we can just click and drag on the CT to move it around. And if we need to as well, we can rescale the CT. So I can just grab on one of these corners, just like resizing an image, and move it up. And in that way, the CT can be matched onto the nuclear medicine. So when you're happy in this stage, just hit next again. Okay, so this is where we're going to use our automatic algorithm to define the lungs. Just going to use the lung window for this. So I hit the F key to achieve that. I make a click in the trachea. So I'm just following these instructions on the right-hand side here to click inside a dark area at the top of the trachea to create the left-right lung segmentation. So right now the algorithm is working with these Hounsfield unit thresholds to find the lungs. You can adjust these if you need to match your local CT quality or reconstruction. As you can see, it's done a good job here. We can just scroll through to check. All looks pretty good. So I'll continue with the processing, clicking next. Okay, so the next step, define a split region between the right upper and the right middle lobe. Press Alt and click on a slice to create control points along the fissure. So this is where you see how important the CT quality is. We have to be able to get a good enough CT to see these fissures. So I'm going to hold down the Alt key and just press 1, 2, 3, 4, and 5 there to define that fissure. So as I scroll, we can see, so that fissure is maintained, but we see that the true fissure is moving away from where I put that previous line. So we can just go again here with 1, 2, 3, 4, and 5. And then you can see the software has interpolated between those two planes to follow the natural fissure. Again, we might need to do one more here. 1, 2, 3, 4, and 5. Let's just say that we're okay with that for now, and then you can do as many of these as you want to fully define the fissure in your patient. And also you can control the number of control points for more or less if you wish. Okay, let's move on to the next step. So the next instruction, define a split region between the right middle and the right lower lobes. Again, we use the Alt-click mechanism to place the fissure. So we can see it's this line here. So 1, 2, 3, 4, 5. And we can see it's put the split there. I'm just going to leave it at that for now to make a fast demonstration. So then the next instruction, define a split region between the left upper and the left middle lobes. So this time I'm just going to press the T key to triangulate there to the left lung. Just have a quick look at where that fissure goes. I'm going to show you, so it's this line. 1, 2, 3, 4, 5. Just going to quickly put those in. We can do a few more if we want. Okay, there we go. Let's stick with that and hit next. So now the software has made those fissures in combination with the lung regions that we drew at the start into volumes of interest. So we've got the right upper, middle, and lower lobes, and left upper and left lower lobe. So we can make a review here if we want to, or carry on and hit next. So right now the software is making a volume render of those regions. This is a really nice image that you can use both for quality checking of your processing, and also you can create this in your print screen to send to packs or to show to your surgical team who will be working on the patient. So we can see the volume render has appeared down here, so we can just take a look around at this one. Looks good. And now we have the option here as the last step to save a report of your processing. We can save that in a DICOM format. So just click Save for the software to go through and take the screenshot. So what you can see here is it's transferring those volumes onto the aligned nuclear medicine. So we use the CT to define the lung lobe volumes. That information gets transferred over to the CT, and then it can work out the counts in each of those lobe regions and then calculate the contribution to the perfusion and ventilation, if you've loaded that, of each of the lung lobes. So we end up with a report generated, which looks like this. So we can see screenshots of our processing, and then the results table here shows the contribution of each of the lungs to the volume, perfusion, each of the lung lobes to the volume, perfusion and ventilation of the whole lung. And therefore you can see the kind of effect that a surgical resection of one of those lobes would have on the overall lung function of the patient. Thank you for watching this video and for your interest in Hermia software.